Good morning, friends. Welcome back to another class of medical classes by Srinidhi Acharya. Please don't forget to subscribe my channel and also give your valuable comment in the comment box. In the last class, we are discussing about Vedana Adhaya and its clinical implementations. So we will continue same in this class also. And we have seen different clinical presentations which are seen in case of different types of disorders like behavioral changes, postural changes, temperature changes, and then feeding problems which are seen in different disorders which is explained under the heading of Vedana Adhaya by Kashyap Samhita we were discussing in the last class. So today we will have some upgraded understanding of the same. Now some of the very important symptoms, rather you can say the clinical presentations which is mentioned in Vedana Adhaya with relation to infant or the neonate or maybe a toddler kid is very, very important for the analysis. And that gives a number of ideas regarding future coming disorders. Many of the time, these symptoms which are mentioned here may not be guiding us to a gunshot diagnosis, but it can indicate many future coming disorders. At times, the 100% diagnosis may not be possible, but if you are able to appreciate that particular symptom, that can give clue to the future diagnosis, and many of the time this will act as neonatal or infantile screening methods. Nowadays, neonatal and infantile screening methods are very important. Why these screenings are done? Screening is done to detect any future coming disorders at the earliest part. If you diagnose or pick up that future coming disorders at the earliest by observing some of the symptoms, then the treatment will be much beneficial and the prognosis is also good. For example, if I am able to find out hypothyroidism at the very earliest part, then it is considered as one of the treatable cause of mental retardation. Congenital hypothyroidism or cretinism, if I am able to identify within 1 or 2 months, then it is a great job because I am giving treatment for the hypothyroidism, and the most common cause of one of the cause of mental retardation in the children is a congenital hypothyroidism. I can able to prevent the mental retardation. If I am able to identify autism at the earliest by observing some of the symptoms, then chance of neuroplasticity is more and I can give some of the results by giving the suitable treatment. Similarly, in case of ADHD, similarly some of the developmental delay, and similarly some of the metabolic disorders. So therefore, Vedana Adhaya is not just limited to by hearting the shlokas and understanding the symptoms, not only limited to identification of the physical symptoms and as well as clinical appreciation. It is also used as, or it can be very effectively used as one of the best method of neonatal and newborn screening, so that future coming disorders can be very well identified and treated at the earliest. So with this background, we shall see some of the important symptoms which is mentioned in Vedana Adhaya in this regard. One of the very important symptom is bathed child looks like unbathed child and unbathed child looks like a bathed child. Asnato snata rupasya snatasya asnata darshanam. So that means this has been mentioned in the context of ama. Okay, this is mentioned by Kashyapa as one of the symptom when ama is developing in the newborn baby or neonate or infant. Okay. Of course, at times if you see very superficially, it is very difficult to understand and explain this problem. Why a unbathed child should look like a bathed child and bathed child should look like a unbathed child. Okay, so now we know that whenever there is ama condition, that suggests the condition of mandagni or there is agnimadhya. Rogaha sarvepi mandagno. Okay, so whenever you are finding this particular clinical presentation, that suggests that ama is going on the body and there is Agnimande is also there and Kapha Vriddhi is also there and Mandagni is also there. So we know that ama is a root cause of all the disorders. So if you are able to appreciate these particular symptoms, one thing that you can ensure is definitely child will going to develop one or the other problems, maybe related to the GIT, maybe related to the CNS in future. Okay, so now actually this type of presentation is simply an observational symptom. Okay, most of the time the observation many times will not have any logic. Okay, so when we should not try to find out the logic, but anyway, collection of the some of the abnormal metabolic waste in the body, collection of the abnormal metabolic waste in the body may lead to this particular presentation. Okay, so there will be guruta, there will be snigdhata, there will be stickiness, there will be shining. Actually these are all things which are appreciated or which are explained in relation to ama. Okay, so we can see a similar finding. That means in case of Mukhamandika Graha, if you see the Mukhamandika Graha, we are slightly deviating from the topic. Mukhamandika Graha, there is also one similar symptom has been explained. What is that? Pani Padasya Ramaniyata. So Pani and Pada, upper and lower limbs of the child looks very, very beautiful. So actually, if you find if you find any logic for it, you cannot get it. But anyway, so what it actually suggests? Actually suggests there is some swelling, there is collection of the fluid. Because of collection of the fluid from a far distance, when you observe the baby, or from a little distance you observe the baby, when light falls on the swelling area, it will get shine and looks beautiful, but it is abnormal. Similarly here also, a bathed child looking unbathed or unbathed looking bathed, it is not a good symptom. Rather it suggests that something abnormal is going on inside the body, but on observation it is giving this appreciation. Ama is also having a guruta property, snigdhata property, stickness and shining property. Okay, that means shining in the sense abnormal shining will be there. Whenever a swelling is there, fluid area is there, if the light fall over that area, so that looks very glazy and shiny. Maybe with this regard, we find similar examples even in case of Kshaya Jakasa also. Jyotisha Iva Darshanam, Srimad Darshana Lochanam. Okay, actually patient is suffering from Kshaya Jakasa, but his eyeball, the appearance of the eyeball is Srimad Darshana Lochanam, just like a very, just like a learned scholar is having the appearance. Again, it may be due to edema and such other conditions. Okay, so therefore, whenever you find this particular clinical presentation by observation, then you have to think that yes, this baby may have collection of the ama. This may give rise to any of the future disorders. Probably, what I think is inborn errors of metabolism, certain types of inborn errors of metabolism, or certain type of fluid disturbances. Okay, fluid disturbances, collection of the edema and all those things should be appreciated, or at least should be inferred, or at least should be thought of whenever you find this type of child, and you have to investigate accordingly. So this is a clue. This clue has been utilized to the maximum extent. This is what is called as neonatal screening or infantile screening in Ayurveda. Similarly, another symptom is there that is told in the context of Pandu and as well as Kamala. So what is the symptom? Rudiraspraha. Nashtagni Rudiraspraha. Okay, how it is possible to drink the blood? So the actually word meaning of Rudiraspraha goes like that. What is that? Baby want to drink the blood. Baby have a tendency to drink the blood. But actually it should not be taken like that. It should be taken in other sense. For example, we know that Raktam Raktena Vardate. That is Samanya Vishesha Siddhanta as explained in Ayurveda. Okay. Now it is mentioned that in case of Pandu and Kamala, child is having more tendency to drink the blood, actual blood. So now practically this is not possible. Okay. But it should be taken in otherwise. Child is having tendency to take blood increasing contents in the food. Now if you take blood and it is oxygenation portion of the blood, one which does the oxygenation work, that is RBC. So then RBC is made up of iron, we know that hemoglobin and all those things. So probably this word indicates that the factors which are responsible for formation of the blood, like B6, vitamin B12, folic acid, iron, to some vitamin C, to some extent vitamin E, etc. So copper to some extent. So these are actually called as hematamics, and these are the blood forming elements. Now this has to be taken as child is having a tendency towards eating blood forming elements. Now again, whenever you find this type of finding, it clearly suggests that child is having anemia. Child is having anemia, we know that, it's very clear. Okay, so now in childhood practice, what are the most common causes of anemia? Just by looking at this particular symptom, this particular tendency on daily routine, child is showing more tendency towards these things. So swasthanasya vriddhi, that means one of the basic principle, always when there will be a tendency, whenever there is kshaya, there is a tendency to take the food that is of similar quality. So that suggests that there is anemia, there is a depletion of the RBCs, either hemolytic pathology is going on, RBCs are broken down, and there is more tendency to take the blood forming elements. That means blood has been lost, or RBC has been lost or destroyed. This is possible in some of the very common disorders in the newborn, because newborns are known for hereditary hemoglobinopathies. Okay, there are different types of congenital hemoglobinopathy or hereditary hemoglobinopathies. We know disorders like thalassemia, we know disorders like sickle cell anemia, we know disorders like sideroblastic anemia, we know disorders like spirocytic anemias. There are different types of, we know that congenital abnormalities, congenital hemolytic problems will be there. And sometimes acquired hemolytic problems because of autoimmune problems will be also there. But whatever may be the case, when child is showing this particular tendency, it clearly indicates there is a anemia, and now we have to look into or screen for different types of causes or different causes of anemia in the newborn. Okay, so just by looking at symptoms, you can appreciate if something is going wrong, and which is more common in newborn period is hereditary hemoglobinopathies or congenital hemoglobinopathies, and we should inquire for that. We should do the investigation to find out that. Okay, so this is the symptom presentation is very simple. Okay, but it gives a maximum effect. This means a future disease which otherwise would have been diagnosed at the age of 2 or 3 years later, where the spleen has been enlarged by that time, liver has been enlarged, and much of the damage has been taken place, and there is no much option for the treatment. That would have been that can be identified at the earliest, maybe at 2 or 3 months, if you are very keenly observing these symptoms. Okay. Similarly, there is one more thing. Why there is burning of the forehead and cold extremities in fever? In Jwara, there is one more symptom is explained. What is that? Panipadasya shitatvam lalatasya abhitapyate. Lalatasya abhitapyate. So this is a symptom which is present in case of Jwara. Now this is very typical again. We should know the difference between a Jwara due to internal causes and Jwara due to microbial causes and Jwara due to environmental causes. Okay, so one of the finding is a Jwara which is occurring because of the external causes, maybe temperature variation, heat stroke, etc., or metabolic fever or drug fever, etc. All the body parts are equally hot. Okay, there is no disparity within the extremities and core. All are equally. Even the pani is also equally hot, and forehead is also equally hot. Okay, whereas in newborn and infant and children, especially toddler area, when fever occur because of some of microbial causes, where temperature regulatory system has been get affected, hypothalamic temperature setup is changed. Okay, it is hypothalamus has been set at a high temperature, and this is possible in case of viral infection, bacterial infections, etc. Now when fever comes to these pathologic causes like pathogens, the pattern of the fever in the children is always extremities are comparatively less hot than that of the forehead. Forehead is more hot, but extremities are not, compared to the forehead, extremities are not so much hot. The same thing is explained by Kashyapa, that panipadasya shitatvam lalatasya abhitapyata. So this will help us to differentiate between an fever of microbial origin and fever of other causes like environmental, metabolic, drug fevers, etc. Or metabolic in the sense thyrotoxicosis, or sometimes some liver problems, etc. Or inborn errors of metabolism, etc. Okay, so the same has been explained here. In newborn, the cranial circulation is always another important thing is, otherwise also most of the time mother complains, my head forehead is always hot. Okay, the reason is in the newborn the cranial circulation is always high compared to the rest of the body, and their forehead is reasonably hot always, reasonably always hot. Okay, compared to the other parts of the body. So this is a normal phenomenon. Anyway, but in case of fever, as I told, increase in the core temperature with the relative decrease in the peripheral temperature will be there in case of fever, which occurs because of viral, bacterial or other microbial causes. Okay, and therefore this is quite common. The same is not seen on the environmental fever. If the fever is because of environmental causes like heat stroke, etc., all over the body you will find the equal heat. Okay, so anyway, the immaturity of the temperature distribution system is also there. We should understand when in Kashyapa Vedana Adhaya he says, it suggests that yes, baby has got immaturity in the temperature distribution system also, therefore the core temperature and peripheral temperature may varies. Okay, and it is also sometimes because of reflex vascular phenomena, some of the reflex vascular phenomena. We find a similar explanation in case of Shita Putana Graha. In Shita Putana Graha also he says, Parshvasya ekasya ushnatvam aparasya shitatvam. Okay, there is also some irregular distribution of the temperature, but in that case again it is the decreased peripheral temperature and increased core temperature. Ekena ushnatvam aparena shitatvam. Okay, but the cause is dehydration there. With Shita Putana Graha we find different diarrhea, different types of diarrheas. So there is in that case the cause is hypovolemic shock. But in this case, it is in case of Jora, what Kashyap explained, it is nothing but microbial fevers doing that. Okay, so we should know that cold sponging is also done on the forehead most commonly in children. Of course, cold sponging on the abdominal area is quite beneficial. Back is also beneficial, but most commonly it is done on the facial area because most commonly the forehead area is more hot compared to the other parts of the body. Of course, it depends upon the blood circulation because in the facial area, the blood circulation is more, and therefore we are trying to cool the blood by cold sponging, and that is the principle behind that. Okay, so now this is another important symptom which gives so many clues. Shitena panipadasya shitatvam lalatasya abhitapyata. Similarly, there is also explanation of Madatya in Vedana Adhaya. Okay. Now, many times students also ask question. So, why there is Madatya? Baby is not taking in alcohol and all those things, and but still the Madatya symptoms are explained for the baby. So, how it is possible? It is not for baby. It looks irrelevant, sir. Many of the times students ask, but actually it has to be understood in different way. Okay. Now here, when child is having Madatya means it is not always compulsory that child only has to take the Madhya or alcohol and then the symptoms has to develop. Now this is also possible in case of mother involved in such activities or in taking Madhya etc., and that has been transferred to the baby through the breast milk, because first 6 months we know that exclusive breastfeeding will be given, and in Ayurveda again we say that up to 2 years breastfeeding should be continued. So now this has to be taken in other ways. Okay, so if the child is having some of the symptoms of Madatya, now one more thing is here, the mother is not, Madatya, the word mada, it should not be taken only, it should be restricted for the alcohol. Mada can be due to other substances like also. Maybe some of the drugs like Ihifen, maybe some of the drugs like Datura, drugs like Vaxanava and Kramuka. So these are some of the drugs which can cause mother to the child. Okay, so now we shall discuss that. Mother who is addicted to the alcohol and other narcotics, etc., may lead to the many problems. We know that one of the most common problems is fetal alcohol syndrome. In the pregnancy, if the mother is involved in alcohol and all. Okay, now this is one part. Mother consuming some of the drugs, or mother is habituated to some of the drugs. Mother is a drug addict. Okay, maybe any phenobarbital and any other drugs. She is a drug addict, or mother is taking some of the antidepressant drugs. All these things leads to a sort of mada or intoxication in the child. Okay, it should not be restricted only to the alcohol. So drug withdrawals drug addiction, then opioid derivatives may lead to withdrawal symptoms in the baby also. Mother is taking that, it is also passing to the baby, and in the baby it may show some of the symptoms. Okay, so even suppose a mother is taking anti-epileptic drug, so that can also lead to some sort of antipsychotic drugs. That is also going to affect the baby. And all these symptoms should be taken as Madhathya. Okay, especially in this particular context, mother is not only restricted Madhathya, that mother is not only restricted to alcohol, it is for the other things. Okay, so now let me see, if you are finding a mother-like symptoms in the child, see how much options it opens now. You have to interrogate the mother, you have to interrogate the mother's drug history, and you have to see that whether that drug is passing through the breast milk or not, or mother is drug addict, mother is taking anti-epileptic treatment. All these things causes a sort of sedation to the baby also, as the things are passing through the breast milk. Of course, some of the drugs are not 100% passing, but some of the drugs are only 5% passing. Anyway, there is every chance that it can pass through the breast milk. So this has to be taken in that context. Now another symptom which is explained in Vedana Adhaya is a normal child during the daytime is not sleeping and crying throughout. Okay, so in many conditions it is mentioned a child is normal during the daytime and cries more at the night. Rodana as a cry you can see. Okay, we know that it is because of the in utero phenomena. Usually a normal baby will not sleep at night and it will sleep only it will go for the deep sleep in the daytime. That is because of in utero habits. Because during the 9 months of the stay inside the uterus, baby, when the mother is doing the work in the daytime or standing position, amniotic fluid is collected in the deepermost portions of the cavity, and the child is get immersed there, and child is taking rest because there is no scope for much movement. At its gravitational dependent area, it is get immersed there. Okay, but in the night time when the mother goes to the horizontal position like sleeping and all, this particular fluid is distributed sideways and baby comes, fetus comes upward superficially, and there is no scope for the movement. So baby used to play at night hours. That is fetus used to play at night hours and take rest at daytime. The same habit will be continued even after the birth also, and that leads to this particular symptom. After birth also, child plays in the night hour and have a deep sleep in the daytime. Now, when we find these particular cry-like symptoms in Vedana Adhaya in many conditions, anaha, in many conditions, in the last class I have explained. So, evening colic, night colic, these are some of the common problems which leads to cry. Similarly, feeding irregularities is also one of the common cause for the cry. Sometimes child get bored, that is also one of the cause. Or certain postural changes causing dyspnea, cough, that is also we have to appreciate. When the baby is crying, in different disorders is mentioned in Vedana Adhaya. Okay, so congenital heart disorders, thymus gland, etc. So that can create problem because of the postural changes. Okay, but suddenly when child start crying with the typical skin change, so that has to be always appreciated for exposure to any of the allergy causing the hypersensitivity and itching. This is simply mentioned as Kitadamsha in Vedana Adhaya. But he says Swastavritta Parobalo Nashet Ratro. That means otherwise normal looking child suddenly starts some crying, sudden itching, then it has to be considered as allergy. One of the basic nature of all the allergic disorder is sudden appearance, sudden disappearance, and reappearance. When this cycle is continued, okay, there will be sudden appearance, similarly sudden disappearance. Within a very short time, these things will go into subside. Once you withdraw from the nidanas, and again it starts. Again when you are exposed to nidanas. It's a typical nature of any hypersensitivity or allergic disorder. So same by this particular sloka he want to give the message. Suppose a Swastavritta Parobalo, a normal looking child again suddenly start crying, maybe because of hypersensitivity. Of course, a similar sort of presentation will be seen in case of metabolic disorders also, but there the problem is not itching, there the problem is like vomiting and diarrhea, etc. Okay, sudden appearance, sudden disappearance, and again reappearance, that will be seen there also. But when itching, mostly it is related to a hypersensitivity reaction. Okay, so this is one of the best time to identify the allergic disorders in child, maybe atopic, maybe non-atopic at the earliest. Okay, Of course, insect bite has been given an example. Insect bite has been given as example in Vedana Adhaya, but as a neonatologist, you have to appreciate these things at the earliest. So we need to infer many such cases in case of sudden crying at night, etc. Okay. So this is one more beautiful things. Early identification of allergic disorders or hypersensitivity disorders in the growing newborn. Now, one more is ants are attracted to the urine. Mutraya vidavanti makshika. Okay. So, in Vedana Adhaya, he mentioned that it is prameha. Okay, if that is present, it is prameha. Of course, prameha, vataja prameha, pittaja prameha, kafaja prameha is there, and all the pramehas are not diabetes. Okay, as we say, all the pramehas are not diabetes. Only madhumeha is diabetes mellitus. So we have a separate class on that. Okay, what is kafaja prameha, what is pittaja prameha, what is vataja prameha. Okay, so we will have a separate class for that. I will not go and discuss. At this point, I can only say this much: all the pramehas are not diabetes, and prameha is not only diabetes. Prameha indicates all the metabolic derangements in the body. Okay, it indicates towards different type of metabolic problems, including inborn errors of metabolism in a growing child. So, how to identify the different types of inborn errors of metabolism at the earliest? Nowadays, we will go for neonatal screening for metabolic problems. Okay, some 32 metabolic disorders will be mostly identified by early screening. Okay, early screening. Ayurveda do have this particular screening. So, they says that in almost all the metabolic problems, suppose child is having inborn errors of metabolism, the abnormal metabolic waste will be excreted through the urine, and as a result, urine color, urine acidity, urine pH, or urine surface gravity, yes, urine surface, sorry. So urine physical and chemical changes will be seen, appreciated. It may be in terms of color, in terms of consistency, and in terms of smell and many things. Okay. Now, suppose if there is inborn errors of glucose metabolism. Okay, that is glucose is not completely metabolized. Then so many abnormal metabolic products of incomplete glucose metabolism will be formed. Carbohydrate metabolism will be formed. And now glucose is excreted through the urine because it is not properly utilized. Okay, so that is utilized, not properly utilized, it is excreted through the urine. Maybe in conditions of galactosuria, glycosuria, sucrose, inborn errors of sucrose metabolism, fructosemia, etc. Okay, so urine is passing, through the urine there is passing of excess amount of the sugar, and definitely it attracts the ants. So this not only indicates the glucose is, we should not limit ourselves to say that yes, glucose is going, so there is some diabetes like condition. No, it can also indicate some other carbohydrate metabolisms, inborn errors of carbohydrate metabolism or glucose metabolism. So therefore, if you are able to identify this at the earliest, so it's so good. We are doing a very good neonatal screening. Similarly, we know that renal glycosuria is quite common in children to some extent because that glomerular filtration capacity is not up to the mark. So some amount of the glucose may pass through in the early part, leading to renal glycosuria. I will not explain much detail about this. Inborn errors of protein metabolism can be taken as kafaja prameha to some extent. Of course, this matter is subjected to, need to be subjected to the discussion. Okay, much discussion is required from the experts. Inborn errors of lipid metabolism can be taken as vataja prameha, or inborn errors of carbohydrate metabolism can be taken as pittaja prameha. This is my assumption. I am not loading on it on everybody. Okay, but these are the things. But one thing is very clear: prameha indicates so many metabolic problems. Okay, now child cry excessively during the voiding. This is another symptom. Okay, mutra kalecha ati vedana and rodana or vedana is mentioned. This is especially satatam rodanam that is mentioned in mutra kricha. Child is crying during the time of micturition. So obstructive condition of this has to be immediately. In Vedana Adhaya, he told us mutra kricha. There is problem for the passing of the urine. But as a neonatologist, comorbid physician, you have to think in other way. you have to inform what may be the possibilities in the child. Okay, there may be some of the obstructive condition of the urinary tract. Okay, or in that time again you have to take, there may be history of oligohydramnios. Usually oligohydramnios cause so many renal anomalies. Okay, or there may be other congenital problems like epispodiasis or tiny urethral opening or post-urethral valve, etc. So usually in the lower urinary tract, when we talk about, painful micturition is present. When the problem is there in the ureter, there is no much of this problem. Okay, but in a lower urinary tract, always there is burning sensation and as well as a pain will be there. So that always suggests the problem in the lower urinary tract. So when baby is passing satatham rodanam during the time of having satatham rodanam during the time of micturition, that definitely suggests some of the problems related to lower respiratory tract. Lower urinary tract. Okay, so this is one more thing. Now differentiate between satata rodana, pratata rodana, ati rodana, alpa rodana, or simply rodana. These are indicating the different gradings of rodana and severity. Okay, when I say pratata rodana, it is most severe. Because it cannot be consoled by any means. Satata rodana means continuous rodana. Ati rodana means in excess. Alpa rodana is less. Rodana is normal. Anyway, so these are the different issues that we have to consider. Now, one more important symptom which is mentioned is baby touches the body parts frequently and crying. Anga pratyanga desheshu. Okay? So this is one of the most common finding, not only in children but also in adults. Okay, if you are having headache, then we touches the head and close the eyes. Okay, if earache, definitely it is our normal tendency to frequently we touches the ear. Anal itching, a newborn or any child, growing child, you may see he is frequently itching the anal area because of anal itching, because of this worm infestation and all. Abdominal pain, it touches the abdomen. So this is one of the common observation done by the Ayurveda people. So they says that, Acharya says that. So this is a very simple way of observation and finding out the problem, because child is not telling anything because of limitations. So, but you need to observe them. Sometimes child assume the typical position when there is pain. Okay, so now udhara stabdatha. So he keep the abdomen very stiff because he know that movement causes the pain. Okay, he assumes certain knee chest position like condition in cyanotic cardiac disorders. Okay, he keep the chest stable in pleurisy because the movement of the chest causes pain. So shallow breathing will be there. There is no deep breathing. In case of meningitis, he keep the spine stiff. That's how the Cornick sign become positive. Okay, so deep respiration is converted into shallow respiration in painful condition of the chest. So baby touches the different parts frequently where during affliction, and also baby attains different postures to come over this discomfort or pain. Now these things are mentioned in Vedana Adhaya very well. In the last class I mentioned different postural changes and different causes why the baby touches the different parts of the body, because this is all the observational things, and if you are keenly observing, you can able to find out or diagnose a future developing disease. Now, increased respiratory rate of the baby. You find this also. Shwasakrachata, Shwasavaroda, many things has been explained. It is important to observe the chest of the baby without touching at once. Okay, this is also mentioned in Vedana Adhaya. Increased and decreased respiratory rate helps to give many diagnoses. Early diagnosis of the pneumonia. Okay, increased respiratory rate. Even nowadays also, increased respiratory rate is one of the main criteria in the community practice to identify the pneumonia. Okay, the same has been mentioned in Vedana Adhaya also. Or there is decreased respiratory rate sometime. This is possible in collapsing lung or ventilation problem, foreign body inhalation. Of course, initially there will be choking and all those things, followed by decreased respiration. During feeding with or mild activity. Now, increased respiratory rate during feeding and then stopping feeding. This is called as a suck rest suck cycle, which is very commonly seen in congenital cardiac problem. So when Vedana Adhaya says Shwasakrachata, child is having Shwasakrachata, Shwasavaroda, all these points has to be understood. Okay, the word like Shwasakrachata, Urasoho Ushnatvam, etc. are mentioned in Vedana Adhaya. Every word has got its significance. If you are observing the baby very cleanly, you are able to identify so many conditions. Now, child is not responding for pampering by the mother. This is mentioned in many times. In Vedana Adhaya, if you see, Stanyamna Abhinandyate, na ramaniyaha. That means child is, especially in the Ama it is mentioned, mother is trying to console the mother by different method, but child is not responding for that. Now one thing is very clear. Baby will not stop crying in spite of pampering and also in spite of feeding. That suggests the problem is not related to the insecurity or emotional problem, and problem is also not related to nutrition or feeding problem. So we have got some different problem, another problem. So this has to be understood. If the mother says that I am trying to console him and I am trying to pamper him, but still I am feeding him, but still he is crying, it point towards it's a big clue for a clinician. Okay, so cause is not emotional, cause is not functional, cause is not fear complex, and cause is not hungry. Then there will be a definite physical cause which is disturbing the baby. Okay, many times baby cries because of different reasons. Now, when this particular presentation will be seen, that suggests that apart from all this is some definite physical problem in the body existing. Therefore, child is crying. Cause may be related to CNS, causing certain involuntary actions which is out of baby's control. Therefore, baby is crying. Okay, so that means, see, I am explaining each and every symptom has got its importance. Only thing is we should have a vision to see that we can diagnose so many things. It's just use of common sense. Okay, so child is not getting normal sleep. Okay, child is not sleeping. A child should sleep, isn't it? Child usually spend in the initial days, it spend about 20 hours in sleep. Good sleep is very much required for the normal baby. Child is not sleeping. Why it is not sleeping? Even after feeding, even after pampering the baby, child is not sleeping. This is also mentioned. Definitely there will be some physical problem is there. Okay, so now this is early identification. All this mentioned, especially these symptoms are mentioned in AMA condition. Okay, therefore AMA is the cause for the future disease. So this is early identification of the AMA in the body, which may later lead to serious disorders. So irritable, restless, less feeding, less sleeping child, more crying child should be always evaluated. Okay, if you see the Prashasta Vala Lakshanas explained by Kashyapa, there also Nidra and Prajagar, these are the two important things. A normal baby should have a proper Nidra and Prajagara also to some extent. Anyway, one more symptom which is mentioned in the Vedana Adhaya is very important, is there will be abnormal shape and swelling of the abdomen. Now see, just by observation, there is abnormal shape or size of the abdomen. This gives so many problems. Scaphoid abdomen will be seen in case of diaphragmatic hernia, congenital diaphragmatic hernia. Liver enlargement, splenic enlargement and other enlargements gives the abnormal shape of the abdomen. There may be ascites. There may be some congenital abnormalities like a Wilms tumor or some such problems. Okay, so abdominal shape and size is very important. So silent, stiff abdomen is mentioned in case of anaha. Okay, so that suggests that there may be some colic problem or digestion problems, etc. Then a structural swelling which is mentioned as nabhya samantata shota in case of Pandu and Kamala. Okay, the splenic swelling, we know that it always goes in a oblique way, starting from left hypochondrium to right iliac region. Okay, splenic swelling always cross the midline through the umbilicus. Hence the word nabhya samantataha shota has been mentioned. Pass through the nabhi area. Common in neonates and infants. Now, again, it is mentioned for the children and infants and neonates because, as I explained earlier, congenital and hereditary hemolytic problems are more common in children, and most of these congenital and hereditary hemolytic problems will have massive splenomegaly along with anemia and sometimes with the jaundice. Okay, so thalassemia, sickle cell anemia, spherocytosis, metabolic errors, etc. may lead to this particular presentation. This symptom along with anemia, loss of appetite, nastagno, loss of appetite, should be considered as early sign of congenital hereditary hemolytic disorders for children. See, one of the best way of identification of congenital and hereditary hemolytic problems in the newborn mentioned in Ayurveda. Nabhya samantata shota, nastagni, ubayatro niruksaha, and loss of enthusiasm. Okay, so in the later stage also there is present with the hyperbilirubinemia and hepatomegaly. In the later stage it can lead to the same, but different conditions related to hepatosplenomegaly should be considered by this particular presentation. Once there is nabhya samantata shota is there, along with nastagni and Ubayatro Niruksa is there. Dull baby, not active child. This has to be assessed. So we can pick up these disorders at the earliest. Now, what is the significance of abnormal behavioral problems? Some of the behavioral problems are mentioned. Abnormal behavioral problems are mentioned. So there will be pralapa, there will be uddvignata, oshtadamsha, akasmat attahasana, abnormal behavior in case of graharoga. Many symptoms in the last class we have seen. Many of the behavioral problems are mentioned. They have given the different names. Just pralapa is seen in case of unmada, and oshtadamsha is in graharoga, akasmat attahasana is in apasma. But you should not limit yourself for this condition. Now we have to seriously consider why this type of pralapa. Pralapa means child is not able to console and it is doing unwanted voice, unwantedly, unnecessarily crying, unnecessarily it is doing some vaichitya is there. Udvignata, child is irritable, child is getting angry, child is not comfortable many times. Oshtadamsha, child is biting its own lips. It's involuntary movement, it's not normal at all. Akasma, suddenly child is having behavioral changes and abnormal behaviors. Now, this is very important to identify, to early pick up for the early markers of cerebral palsy, autism spectrum disorders, attention deficit disorders, learning disabilities, different stages of mental retardation. See, we should not limit Vaichitya means it's only Umada. We should not limit that. Just observe all those symptoms. Leave the disease which is mentioned there. Observe the symptoms which are mentioned there. Okay, Vitrasa is Vaichitya is there, Pralapa is there. Okay, so when Pralapa like conditions are there, Udvignata, irritability is there, child is doing its own stereotypic movements, okay, is biting the lips always, okay, sudden behavioral changes, they are never normal. They can be the early markers of cerebral palsy, autism spectrum disorders, ADHD, learning disabilities, and different stages of mental retardation. Okay, so here Akasmat Attasanam is mentioned, but in newborn there is one smile is that's called as fantasy smile. That is called as fantasy smile. What do you mean by fantasy smile is such symptoms are common in the early days of neonate. Because the immature cortex, limbic system is very immature, it is not able to differentiate all the feelings, emotions and all. So it gives a mixed type of feeling for all the emotions. Okay, so that's for all the stimulus. Sometimes it may be frown the eye, sometimes there is a crying like appearance, sometimes laughing, sometimes smiling, like that. Different things we will see. Okay. Sometimes maybe the withdrawal symptoms. Okay, in the early neonate, when baby showing this type of behavioral changes suddenly, and later it subsides, it may be sometimes withdrawal symptoms related to some of the drugs, pyridoxine withdrawal symptoms, hormonal withdrawal symptoms, okay, drugs withdrawal symptoms. In the form of convulsions also, these particular behavior can occur sometime. Okay, neonatal seizure convulsion is a big topic again. So these are some of the important things which is mentioned in the Vedana Adhaya, which helps a lot for the screening of the newborn or screening of the infant. And nowadays also we have nowadays the screening of the infant has been taking a lot of importance as far as early identification of the disorder. That is very important because see, autism, if I diagnose at the age of 5 years, it's not a big issue and I cannot do much there. Same autism, it is identified at the 6 month of age, I can do a lot of things and prognosis is also good. So that is the benefit of Vedana Adhaya. Therefore, keenly observe each and every symptom of Vedana Adhaya and try to see it in the baby. And if you find that symptoms, infer for the future coming disorder and start investigation, find out the disease and start the treatment, you will have a better prognosis. This is the great utility of a Vedana Adhaya. So with this, I conclude. Again, don't forget to subscribe my channel and also give your valuable comment. We will meet in another class. Thank you very much.